Hello everyone, this is Vanessa, the Clinical Change Lead for Operating Theatres.
And Terry Williams, Anaesthetics and Recovery NUM. So this is the entrance, one of the two ways into recovery from the internal theatre corridors. These doors will most likely be held open so that patients can just be driven straight into recover. This is the end which has an accessible toilet for patients and relatives, adjacent to where the blanket fluid warmers and linen will be parked, because we have those at both ends. Bit of a look at the rest of recovery, and here's the staff toilet that's also within recovery. Looking at one of the two bariatric sized recovery bays, and then we have 30 standard sized recovery bays, and as you can see it's palatial, and you can see from one end of the unit to the other. We've tried to minimise the things hanging from the ceiling, and we've got all of the monitoring and things mounted on the walls with other accessories and things yet to be added. You'll notice above every sink there will be a clock with a sweep hand for measuring resps. So wherever there's a sink, you'll find a clock directly above it so that you're not needing to look other places. We've got IV poles hanging from the ceiling for the head end of the bed, and we will have freestanding drip stands for the foot end of the bed for those urology patients and similar type things. This is the dirty utility room that is right next to the staff station. All the usual things you'd expect to be in a dirty utility room are in there. Plenty of hand wash basins about the place. This is the one opposite the front desk, or the recovery staff station, and is actually right next to where all of the emergency trolleys will be. So the defib trolley, the Morgan trolley, the paediatric resusc trolley. We're also going to have the fridge for the apple juice and ice blocks. Opposite that is the exit to recovery doors. We'll come back to that, and the recovery clean utility room. Our drug room. This is the recovery staff station, so you can see out from that and see 30 of the 34 spaces whilst standing at the desk if you're tall enough. And behind the desk you've got the central station monitoring for all of the networked monitoring in all of the 34 bays. The bays are the 30 of the bays are a standard size, the same as the current recovery, because that's what the standard is. The 4 bariatric size spaces, there's 2 with doors and 2 that are open, are additional spaces that we have now, which is excellent. Gives us some more circulation space, especially if we're needing to do things like, catheter insertions or fiddling with central lines and things like that. There's one of the other bays, and we're just coming up now to one of the 2 seclusion rooms, which you could use for children, developmentally delayed patients that need to be isolated, if corrections needed somewhere with a door, thousands of different ways we could use these 2 particular spaces. There's one at either end of the suite. And next to that is the other of the bariatric bays. Then at this end of the recovery suite, you get more hand basins, and it's the other blanket fluid warmers. This is the other entry into recovery from the opposite side, because recovery is in the middle of the entire suite. So we'll have 2 feed-in ends, so patients can come from either side into recovery, more linen and blanket fluid warmer space. And this is also the pathology bay for recovery. So that's where our recovery blood gas machine will live, with an underbench fridge and those sorts of things for pathology needs. This is the recovery storeroom. Notice the swipe lock to stop people from nicking our stuff. And we've got some beautiful shelving options in here to maximise the amount of space. It's exactly the same size as our current recovery storeroom, so it's going to be a squeeze to fit in all the things that we usually like to have. But given this new shelving system, we should have no worries keeping absolutely everything that we need and maybe a bit more, so that recovery is independent and has all the stock that they need without needing to go travelling for it and going to other storerooms to collect things. So this is the exit journey out of recovery. All patients will come past the staff station and past where the emergency trolleys and things are, and out this one set of doors, which then goes across a little corridor through a glass door, and then what you're looking at there is the 6 patient staff lifts. And directly ahead from there is the linkway that links across through to E3I and E3H. This is just a quick sneak of a anaesthetic bay, which is a bit standard. Short bench, plenty of room for trolleys, plenty of room for wall spaces for hanging stuff, little procedure light from the ceiling, wall-mounted monitoring, little bar there for mounting on the suction and those kinds of things, and as much space as we can for trying to put stock in there. And that's it for the sneak peek of recovery and an anaesthetic bay. Thank you very much. If you have any questions, please feel free to ask either myself or our change champion, which is Laura. And yeah, look forward to showing you more things as things change, and we can get you guys over there for a first-hand look.